According to medical expert Jaco de Jager, a one-size-fits-all approach to breast cancer is just no longer acceptable in the genomic era. His MBA research led him and a team of doctors assessing the need for chemotherapy and expensive testing in low-risk individuals. But what does this all actually mean? Well, Jaco de Jager is live with us now. Thank you so much for joining us. In layman's terms, what did your research find when it came to breast cancer prevention and treatment?
Good morning, Annika. Thank you for the opportunity. So shortly, what we've been looking at the historical reference patterns for breast cancer patients that were admitted to this test. And we found that the way it was administered was leading to a significant cost increase. Now, it's important because one of the things that this test can do is it can help to avert or identify cases where breast cancer or chemotherapy will be unwarranted for certain individuals. So it's a mind shift that we need to go through to move from clinical pathological factors and look deeper into the genomics of the underlying cancer to allow for a better treatment decision.
How did you come about this particular research?
So I've got some background in biochemistry, and during my MBA, there was a research topic that came about, and then I was exposed to Professor Mani de Klerk, who is involved in these types of things and getting new promising technologies commercialized. And then he introduced me to the team led by Professor Marita Kotze and Dr. Etienne Myberg, who's a clinical oncologist.
I presume, Jaco, that treatment really would depend on what stage of breast cancer the patient is in. But what savings did your research find are indeed possible?
Yes, so this, correct, it's dependent on the stage. So this is for early breast cancer patients. So when after the surgical interventions have concluded, then the decision is to be made whether to go yes or no for chemotherapy. That is always the question for patients who suffer from breast cancer. So what we found was, based on the historical patterns, that the treatment cost overall, considering both with the genomic test and the chemotherapy afterwards, the way it was done, it led to a sharp increase in overall costs in cases when patients weren't always getting the benefit of the test. However, what we have to find now is we've determined the factors under which conditions the test will be cost effective, and we found that we can have savings of up to 20% for certain cases of breast cancer. So it's a benefit to the medical aid schemes who have to fund these things, as well as to the patients who can be averted unwarranted chemotherapy for their breast cancer.
Jaco, I know quite a few women who have a genetic disposition to breast cancer. They go and get their tests, their mammograms done, and they're pretty good about it. Are you saying that this test could be made available before one actually even goes for a mammogram?
No. So the genetic predisposition, which is also compounded by lifestyle factors, just increases the likelihood of getting a cancer, and that is let's call it the healthy cells that are in our bodies. What we are looking at here is that this test specifically looks at the specific cancer and the underlying genes that are involved with this specific cancer. So it's not looking at let's call it the healthy cells, it's looking at the unhealthy cells. So this test is used during the diagnosis of making the decision, should I get chemotherapy, yes or no?
All right, thank you so much. Fascinating research, and I do hope you get an uptake from the medical aids from this, especially, Jaco, because it certainly could reduce costs for all of us.